Our program is set up with a cohort of 8 residents per year for a total of 24. And right now we're at 22 because we're still filling our cohort for the MyDocs program, which will be filled in the academic year 22-23. We're a strong program situated in Saginaw with community-based hospitals. There's 2 of them here. And we're affiliated with the CMU College of Medicine as well.
There are a lot of unique things about our program. One thing in particular is our orientation block. Our interns spend an entire month in our orientation month. They get to spend a couple days in our inpatient family medicine service, our inpatient pediatric service, a couple days in our clinic, and just spend the rest of the month exploring Saginaw and the community. All the interns are in it together, meaning they get a real chance to bond and build a solid relationship with each other.
You can break down our training and or educational sites into 4 to 5 locations. Within that, we have 2 hospitals here in Saginaw, St. Mary's and Covenant, with a combined bed capacity of approximately 800 to 900. That is where you can think most of our inpatient rotations are located, whether you're doing an elective in cardiology or simply running the inpatient family medicine service.
We help staff their emergency medicine ward department. We help staff the inpatient unit, the intensive care unit. Really great, thorough, and comprehensive hospital experience.
Our main office that the residents see patients out of is the CMU Primary Care Clinic off of Concentric, and that's where they do their day-to-day patient encounters, procedural clinics.
We have a diverse patient population with multiple comorbidities, so it's great for practicing physicians. We get to see pretty much everything and manage pretty much everything.
We are located in a both rural and urban environment where we're situated. And that being said, we see quite a breadth of patients that come to our clinic. The other interesting thing about Saginaw is that we are one of the largest cities this far north in Michigan, and as we go further north, there are much more limited access to medical providers in general. So we do have a lot of patients that come to Saginaw just to seek specialty care.
The breadth of that population base allows us to gather enough patients to train our residents very well.
The best part about our inpatient experience is our cap. Because of this generous cap, we can spend plenty of time getting to know our patients on a personal basis and really learn what's going on, why they're being admitted, and how to appropriately manage them.
The residents do most of their didactic sessions here at the Stone Street building. This is also where the sim lab is located.
One thing we're really proud of here in Saginaw is our simulation lab. And within that lab, we're able to train the residents for not only procedures, but running simulation codes.
The residents are staying sharp so that when they're working night flow in the hospital or they're faced with these real experiences, they know what to do. It's instinctual.
We can practice traumas, we can practice just general outpatient procedural skills like incisions and drainages, and whatever we want to experience, we can prepare for it safely in our sim lab.
The sim lab has definitely exceeded my expectations. If I have a procedure coming up and I'm nervous about it, I can book a session with the sim lab and practice the case beforehand.
Not only do we do procedural practice in the simulation lab, we also do patient case-based scenarios. So our residents are working through how to have difficult conversations, how to talk about advanced directives, how to talk with patients about a difficult diagnosis and next steps, or how to even broach that conversation.
It's been really helpful to bring that experience with me to clinic so that face-to-face with a patient isn't the first time that I'm having that uncomfortable conversation, but that we all know how to get through it together and support each other.
One of the things that we like to do here at CMU is push ourselves to teach outside of the box. So not only are we doing didactics with death by lecture format, they are also doing different things in the community, like poverty simulation. We have our residents learn how to take public transportation and figure out how to get to appointments when they don't know how to get the transportation. We have the residents go to pharmacies or see how much the medicines cost, even over the counter, and try to figure out if on a limited income they themselves would be able to afford it. And so again, that really enhances our resident education and makes them more prepared for independent practice after graduation.
Every program in the country would want to have the type of faculty that we have. We have faculty that range from being former program directors at this institution or other institutions. We have faculty that have just recently graduated, so are bringing in different nuances to resident training, that are bringing in new ideas and how to incorporate them into resident training.
That breadth of knowledge that our faculty bring to clinical education enhances every experience that the residents have in clinic.
The one thing that was pleasantly surprising for me was actually the relationship with my attendings. Mentorship is very important to me, especially as a physician in training. There's a lot that I don't know. So if there's an admission in the hospital, or if there's a confusing clinic case, I can go to them right away, I can pick their brain, and they're always available to guide me.
One thing we take very, very seriously is that mentorship, is that ability to walk up to any faculty member, depending on that faculty member's interests, to use them and their tools as a mentor to enrich your training.
Our residency provides us with a great opportunity to work side by side with different faculty, different specialists. Electives include things like hospital medicine, different internal medicine specialties like cardiology, pulmonology, nephrology, so on. We have outpatient electives, rural medicine, sports medicine, and anytime you choose one of those electives, you are one-on-one with a specialist. So they're teaching you, they're guiding you through procedures, they're kind of tailoring the experience to whatever it is that you want to gain from it. So we get a lot of really great learning opportunities with our attendings.
That's the nice thing about being part of a community-based, academically affiliated hospital. We have other residency programs here, but not so much that it's overrun with learners.
If an incoming candidate has a certain interest in providing hospitalist care or entering into a sports medicine fellowship or providing rural care, we will actually have concentrations and or streams created where the residents can identify those interests, bring them up with their faculty mentors, and then engage in learning in such a way that they're actually prepared for their individual pursuits upon graduation.
Wellness is a big part of our program. We actually have a built-in slot of wellness in our curriculum.
We have one wellness half day during didactics per block. If it's nice out, we might do a park activity. We've gone kayaking together before, we've gone hiking.
We do activities like laser tag, going to the arcade, or even going for a walk at the park just to catch up and bond.
It helps just foster relationships, trust, so that we work better in and out of the hospital with each other. At the end of the day, we are not just a family medicine residency program, but it feels like we're a family based on how much time we spend together, based on how much fun we have with each other.
They're not just my colleagues anymore, they're actually like a second family to me. And being away from my family, it's nice to have them by my side.
Saginaw is a great place to train. Whether you are interested in living in an apartment, a condo, a home, it is very affordable on a resident salary.
Coming from California, I was looking to escape the big city life, the rush hours, the expensive apartments. I can actually afford to live here. I don't have to leave an hour early to get to the hospital.
We also have a lot of things to do here in Saginaw. We have a downtown where there's a lot of different bars, restaurants, and there are different activities in the area too.
If you choose to indulge in the arts, there's multiple museums in the area. If your passion is more sports related, we have a baseball team located in Midland, which is only 20 minutes away. A OHL hockey team here in Saginaw, which is just within the downtown core pretty much.
For people that are interested in outdoor activities, great hiking, great camping. I've fallen in love with kayaking, really good bike tours. So there's definitely plenty to do in the community as far as free time goes.
If you're still on the fence of where you want to do your residency training, really think about what you want to do after residency, whether it be outpatient primary care, whether it be inpatient, whether it be a combination of the two. We will prepare you to do that. If you want to be in a rural setting, if you want to be in an urban setting, we will prepare you to do that because of our location, because of our training, because of the breadth of the faculty backgrounds that we have. We will prepare you to do what you want.
We have phenomenal faculty, wonderful co-residents, plenty of resources that are available to get you ready to be the best possible family medicine practitioner after residency. It'll be an experience that you never forget, and it's truly a decision that I'm really thankful I made every day.